Hello, my name is Saswat Saravanan, and the skill I've chosen to present is a venipuncture with the Vacutainer. A note I would like to make is that I have chosen to do the procedure on a dummy arm to prevent invasiveness. However, a drawback to this is that the patient can't bridge the arm themselves. Therefore, I had an assistant bridge the arm for procedures that required it. Thank you and enjoy the video. First step in a venipuncture is to look at the requisition form and identify the materials as well as set up the materials needed before the patient walks in. This serves two purposes. The first is that it saves time for the phlebotomist and the patient, and the second is that it ensures that the lab will get the right kind of blood samples. The second step is to identify yourself as well as verify your patient's name and date of birth in order to make sure that you are drawing from the right person. My name is Saswat Saravanan, and I'll be your phlebotomist today. Can I verify your name and date of birth? The next step is to wash or sanitize your hands in order to protect your patient as well as yourself. You will then need to apply a tourniquet to identify a vein to poke. Next, clean the site of phlebotomy with rubbing alcohol and palpate for a vein to stick. The rubbing alcohol has the added bonus of agitating the veins slightly in order to make them pop more for easier identification. Untie the tourniquet after identification. The next step is to apply all PPE or personal protective equipment that is required. In this case, the PPE required is gloves. Make sure to do this in front of the patient. Once this is done, assemble the Vacutainer needle by screwing the needle into the tube holder. The next step is to reapply the tourniquet to make the veins bulge so it is easier to find the vein that you identified earlier and stick it. Make sure to open the needle away from you to prevent injury. Next, announce to the patient that they will feel a small poke and insert the needle. Small poke. Once the needle has entered the skin, you may insert the tube into the tube holder. If blood flow does not establish immediately, draw back the needle slightly. Once the first tube has been filled, remove it and replace it with the second tube. After blood flow has been established with the second tube, untie the tourniquet and wait for the second tube to completely fill up. Remove the tube once it's been filled. Next, take a cotton swab or a piece of gauze and lightly apply it as the needle is being removed. Once the needle has been removed, put it in a sharps container and apply pressure with the cotton swab onto the wound. The phlebotomist must then invert the blood samples 8 or more times in order to prevent coagulation. This can be done by rotating the tubes in a figure 8 motion. The phlebotomist must then make sure the patient has stopped bleeding and thank them. Thank you so much for cooperating. Once the patient has left, the phlebotomist must make sure to discard any PPE, discarded Vacutainer material, con swabs, or alcohol wipes in an orderly fashion. The phlebotomist must then mark and label the blood samples collected and then send them off to the lab where they can be analyzed and the blood work can be given back to the patient. This is the last step in a venipuncture.